The key point is that patients who are known to have an activating EGFR mutation, we know that the vast majority of them will respond really well to a first or second generation EGFR TKI, but that resistance is going to develop for patients on average around 9 to 12 months. Of course, there are exceptions to that, and we all have a few patients who are on years. However, when that resistance develops, it's always a struggle to know what to do. And so what we've now know is that for about 50 to 60% of patients, they become resistant because they develop T790M, which is a resistance mutation that develops within EGFR. And where there's been a lot of work is in fast ways to identify that mutation when it's developed. So we still have the standard tissue biopsies and then going back and looking for that particular mutation. There's also work being done with serum tests that are based on looking for it within the circulating tumor DNA, and even kind of a little earlier in development are urine tests. So it's now becoming standard that if someone has been on an EGFR TKI and developed resistance, we want to figure out why. And we mostly want to figure out why because if we can identify the T790M mutation, then we now have on the market osimertinib, which is a third generation EGFR tyrosine kinase drug, which works in the majority of patients who have developed T790M as their resistance mechanism.